Did you know that millions of people are walking around with bile stones? And many don't even know it until they're in an emergency room? Gallstones, also known as cholelithiasis, form silently in the gallbladder, but can trigger sudden, severe pain, inflammation, and even pancreatitis. Understanding how they form, who's at risk, and which interventions work is key to prevention and treatment. Bile stones develop when bile, a digestive fluid produced by the liver and stored in the gallbladder, becomes imbalanced. When cholesterol concentration exceeds the solubilizing capacity of bile salts and lecithin, cholesterol crystallizes and forms stones. These are cholesterol stones, the most common type. Less frequently, pigment stones form from excess bilirubin, often seen in people with chronic hemolysis or liver dysfunction. Impaired gallbladder emptying further promotes stasis and stone growth. Several factors increase the risk of gallstones. Genetics play a role. Variants in genes like ABCG5 or ABCG8 can lead to increased biliary cholesterol secretion. Conditions such as obesity, insulin resistance, and diabetes alter bile composition and gallbladder motility. Hormonal factors, particularly high estrogen levels, are linked to increased cholesterol saturation in bile, explaining higher prevalence among women, especially those on hormone therapy or during pregnancy. Scientific evidence supports several natural agents that may help prevent or dissolve cholesterol stones. Ursodeoxycholic acid, TUDCA, a bile acid, is effective in promoting bile flow and reducing cholesterol saturation. It's best taken in capsule form, around 250 to 500 milligrams per day. Patients taking statins or bile acid sequestrants should consult their physician first. Artichoke extract, Cinara scalamus, stimulates bile production and improves fat digestion, helping to keep bile cholesterol soluble. Standardized extracts taken at 300 to 640 milligrams 3 times daily are most effective. Caution is needed with anticoagulants or diuretics due to potential interactions. Turmeric, or more specifically curcumin, improves bile solubility and gallbladder contraction. It's effective when taken in high bioavailability forms, typically combined with piperine to enhance absorption. Curcumin may interact with antiplatelet drugs and blood sugar medications. Lecithin, a source of phosphatidylcholine, helps emulsify fats and prevent cholesterol crystallization. Doses of 1.2 to 2.4 grams daily are generally safe and can help stabilize bile composition. Interaction with cholinergic agents is rare but possible. Preventing bile stones is achievable through lifestyle. Maintain a healthy body weight, but avoid rapid weight loss, which paradoxically increases stone risk. Consume a diet rich in fiber, healthy fats like omega-3s, and adequate hydration. Avoid prolonged fasting or extremely low-fat diets, both of which can impair gallbladder function. If you're at risk or experiencing symptoms like upper right abdominal pain, nausea, or fat intolerance, it's essential to consult your healthcare provider. Early diagnosis and targeted natural or medical treatment can help avoid painful and costly complications. Follow and subscribe for more science-backed facts.